to discuss the medial medullary syndrome, first I want you to understand and memorize one thing. Let's say I'm trying to, draw an ant. Let's just say a happy ant, and these are the colorful M&Ms. Okay, so these are colorful M&Ms. So from this you can just memorize that this ant is for the anterior spinal artery, and from these M&Ms you can recall the medial medullary syndrome. So to understand the medial medullary syndrome, let us go to the cross section of the medulla. So as we are dealing with the medial portion of the medulla, so let's just say that if this is the lateral portion of the medulla, this is the medial portion. Again, this is the medial portion and this is the lateral portion. So when we are talking about a lesion of the medial medulla, we are basically referring to this part of the medulla. Okay, so or specifically we can say that this is the territory of the anterior spinal artery, which of course is a branch of the vertebral artery. So I only want you to understand three important points here, one of which is this is pyramid. So pyramids are basically formed from the corticospinal tracts. So corticospinal tracts is for the voluntary motor movements. Again, here the second one is the medial lemniscus. So medial lemniscus is for the sensations of the position, movements and tactile discrimination, or I can write it in inverted commas as proprioception. And the third thing is the cranial nerve nucleus, cranial nerve 12 nucleus, which is the hypoglossal nerve. So this right here is hypoglossal nerve. So whenever there will be a question of medial medullary syndrome, it will be always asked in a triad. So there will be a triad of symptoms, so one of which will be due to the corticospinal tracts, other one medial lemniscus, and the last one which is the hypoglossal nerve. The findings of corticospinal tract will always be contralateral, medial lemniscus contralateral, and hypoglossal nerve ipsilateral, meaning the same side. So the function of the corticospinal tract is basically the motor voluntary movements. So any lesion of the corticospinal tract will result in the contralateral hemiparesis. Okay, and any lesion in the medial lemniscus will result in contralateral loss of sense of position, movement and tactile discrimination, and of course it is going to cause ipsilateral paralysis of the tongue muscles. So if I say there is right-sided medial medullary syndrome, what will be the findings that you will see in the patients? So first of all, or specifically, left-sided paralysis of upper and lower limbs. Then we'll have a contralateral or left-sided loss of proprioception and right-sided loss of tongue muscles. So whenever there is a loss of the right side or there is a paralysis of the right side of the tongue will deviate to right side. The tongue always deviates to the affected side whenever it gets paralyzed. So with this we'll solve these questions. So question 1, we have a 65 years old man who develops sudden onset weakness on the right side of the body. So on examination he has right sided hemiparesis. So hemiparesis means both the upper and the lower limbs are gone. Right sided loss of vibration and proprioception. So right sided यहाँ पे हो गया, and tongue deviates to the left on protrusion. So यहाँ पर there is a classic triad of the medial medullary syndrome. So the lesion most likely involves the medial medulla. So it's very simple to answer such questions. So question 2, a patient with medial medullary syndrome already diagnosed is unable to move his tongue properly. Which artery is the most likely occluded? So pica no, ica no, basilar artery no, vertebral artery is the last option, and that is correct because the anterior spinal artery is a branch of the vertebral artery. Next question, a stroke patient presents with contralateral hemiparesis of the upper and lower limbs, of course, contralateral loss of vibration and proprioception, and ipsilateral tongue deviation. So again our triad of the medial medullary syndrome is clear, and MRI also confirmed there is a lesion in the medial medulla. So which structure is not affected? So we already know which structures are affected. Corticospinal tract will get affected, medial lemniscus will get affected, hypoglossal nerve fibers will get affected, and spinothalamic tract is our answer, because we are here referring to the structure which is not getting affected from this syndrome. So I hope this is clear to you all. Thank you.